My name is Kristen and thank you for attending this continuing education session. Today we will be discussing the important topic of health literacy. To start, our objectives: at the end of the session, the learner will describe how low health literacy can negatively affect a patient's care, list possible red flags indicating a patient may have low health literacy, as well as describing ways to improve communication with our patients. And to define health literacy, it's the ability to obtain, process, and understand basic health information and services needed to make appropriate health decisions and follow instructions for treatment. Health literacy includes skills necessary for an individual to participate in the healthcare system and maintain good health. These skills include reading and writing, calculating numbers, communicating with healthcare professionals, as well as using health technology. Factors that contribute to low health literacy first includes a person's general literacy. How well are they able to read, write, understand written text and numbers? If we're giving them information on a piece of paper, education materials, discharge instructions, and it's all in written print form, and they aren't able to read well, they're not going to understand the information that we're giving them. Other factors include the complexity of the information being presented. If they're newly diagnosed with something they've never heard of before, or it's a complex disease with multiple factors that may be difficult for them to really grasp. They have to make multiple lifestyle changes. They have to understand how to use a glucometer in the case of diabetes. This can all be difficult information for them to really grasp and to understand, as well as cultural influences on decision making and how material is communicated. If we're speaking with a Hispanic patient who understands very little English and we're communicating to them in a language that's not their primary language, they're not going to understand what we're saying. They may not understand all the information that we want to provide to them because we're speaking to them in a language that's not their own. And how health literacy negatively affects the patient's care. Well, it affects the patient's ability to navigate the healthcare system. It can be difficult for them to make appointments, to find providers and services. After being discharged from the hospital, they may not be able to go to follow-up appointments or figure out what appointments they need to make in order to navigate the healthcare system. And part of this is also filling out forms. You walk into a hospital or a doctor's office, we typically give our patients forms to fill out. If they don't understand written material, they're not going to be able to fill out a form very well, or if they have trouble seeing, this can also be an overwhelming process for them. So, health literacy can affect a patient's ability to navigate the healthcare system. It can negatively affect their ability to share personal and health information to providers. They may not be able to articulate what it is that's actually going on. It can make it difficult for them to actively participate and manage his or her own health care. That includes asking questions about their diagnoses. They may be scared to ask questions. They may not ask questions about medications or procedures. And it makes it more difficult for them to engage in self-care and chronic disease management. So let's put ourselves in the shoes of a person who may have low health literacy. What is it like for a patient? You see this paragraph on the screen. Take a minute to try and decipher the material that's in it, and then we'll go through it together. So in the interest of time, let's go through this together. Your physician has recommended that you have a colonoscopy. Colonoscopy is a test for colon cancer. It involves inserting a flexible viewing scope into your rectum. You must drink a special liquid the night before the examination to clean out your colon. Reflecting on that, picture yourself as a patient struggling to read information because they don't read well or they don't understand written text very well. Did you find that you were more focused on decoding the message as opposed to actually understanding what the paragraph meant? Imagine yourself as a low literacy patient being handed forms to fill out or information sheets to read or discharge instructions. It can be an overwhelming process for a patient to try to get through the material. Therefore, they won't understand the meaning behind what we're actually providing to them. And this can be very overwhelming for patients. Looking at another example, which may be difficult to see on a PowerPoint, but this would also be difficult to see up close. As you may notice, this questionnaire, this medical history questionnaire, looks a little blurry. To an older patient that may not have the best vision, this could be what a form looks like when we hand it to them, which, as you would guess, would be pretty difficult for them to fill out. In addition, thinking about, again, non-English speaking patient being handed a form that's not in their own language. Again, that can be very intimidating, not knowing what to fill out. So patients can either get help filling out the form or avoid it completely, thus, again, affecting their ability to navigate the healthcare system. Thinking about the form that we just saw, was it harder to view the blurry words? Again, many older adults have difficulty reading small print. And then consider what it's like to fill out a form not in your language. Again, all part of low health literacy. I'm going to show a video clip by the AMA. I'm not going to show the full video clip, again, in the interest of time, but this is a little bit older video, but still has good examples of some lower health literacy patients.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess he doctor gave it to me, so it's okay for me to take it.
Small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say one tablet twice daily, I don't know if the top can take one in the morning, one in the evening, or take one in the afternoon or one in the evening. So usually what I do is take 2 of them in the morning. And this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
Okay, so again, that's just a short clip of the AMA's health literacy video, but it does show some examples of patients that struggle with health literacy. Now, what does this mean for patients? Those with low health literacy have a difficult time understanding information discussed in the hospital at a doctor's appointment. It may mean an asthmatic less likely to know how to use their inhaler, or a mother less likely to know how to use a thermometer to take the temperature. Again, patients having difficulty filling out the form. It can result in medication errors, lower rates of treatment compliance, reduced use of preventative services, which could mean an increased use of emergency room services. ineffective management of chronic conditions, longer hospital stays and increased hospital readmission rates, and higher mortality rates. So we know health literacy is an important topic, but what are some strategies to enhance health literacy? First, we need to identify the patients with limited health literacy. Sometimes they can be difficult to identify. You can't always tell by looking. They may speak well and appear knowledgeable or well educated, yet still fail to grasp disease concepts or understanding how to follow medication instructions or how to properly manage their chronic condition. Patient safety screens can help to identify these patients, as well as learning how to recognize red flags. Our red flags include patient registration forms may be incomplete or inaccurately completed, not following medication directions or procedures, lack of follow-through with laboratory tests, imaging tests, or referrals to consultants, difficulty in explaining medical concerns can all be red flags as to identifying a patient that may have lower health literacy. Responses when receiving written information, other red flags. Someone could say, I forgot my glasses. I'll read this when I get home. Or, I forgot my glasses. Can you read this to me? Let me bring this home so I can discuss it with my children. Also, many who fail to understand health information may avoid asking questions in fear of appearing stupid or uneducated or annoying. So, they may feel intimidated to ask questions, in which case this is where we really need to learn how to improve our communication with patients. The St. Vincent Charity Medical Center introduced these steps to improving communication, which involves speak slowly, teach back, encourage questions, use plain language, and show examples. First, speak slowly. Take your time when explaining information. Take the time to understand a patient's concerns, and also limiting the amount of information provided at each encounter. Information is best remembered when it's given in small pieces and repeated. Teach Back is a great tool. It confirms that patients understand teaching by asking them to repeat the instructions or explanation back to you. So you show them how to do something or explain to them a concept, and then asking them to give a return demonstration or explain it back to you. It helps to not use close-ended questions such as, do you have any questions? Because it's very easy for the patient to just say no, out of ease, out of fear of appearing, stupid. Or do you understand? Does that make sense? Most of the time they're going to say yes. So if we use open-ended questions such as, what questions do you have? What can I explain better? What else would you like to know about? This whole open-ended questions encourages questions, patients asking questions. It makes them feel comfortable. Also, sitting with the patient rather than standing with the patient so that we can be on their level, and it eases it makes it easier for them to communicate. We can have better eye contact, and they do really feel more comfortable as opposed to us standing over them. Using plain language, non-medical terminology, words that they use in their day-to-day conversations. It makes it easier for them to understand, and patients appreciate clear and concise. So instead of, I need to check your glucose, I need to check your blood sugar. Take this orally can be confusing for patients. Rather say, take this medication by mouth. And addressing barriers. All patients have different needs. Instead of handing a patient a form to fill out, go through it with them. Find language-specific materials, which the patient can understand because it's written in their language, and take the extra time for those who need it. Using the language line. It's not as intimidating as it seems. It's a phone call, and then patients can really have an interpreter who can interpret the information that we're providing to them. Creating and using patient-friendly educational materials. Materials should be limited to only the content that the patient needs to know. Avoid content overload. Consider the age and culture of your audience. Use 1 or 2 syllable words. Usually information is best when it's written at a 5th or 6th grade level. And bulleted lists are preferable over blocks of text in paragraphs. I'm sure we can all agree to that as well. So, in summary, ways to enhance health literacy includes identifying patients with low health literacy, identifying the individual need of the patient, improving our communication, and addressing the barriers. If we spend some extra time where it's needed, it can make a huge difference to our patients and their ability to care for themselves. So, that summarizes my presentation. What questions do you have?